This video is about the sequence of events that go into a phalloplasty. And the big message here is that everybody does these differently. And what really defines a center or an institution, at least in reference to their phalloplasty, is what are those sequence of events. So let's address the first question out there that I get all the time. And a patient comes in and say, well, I hear there's a single stage phalloplasty out there. And that's a misnomer from the standpoint that a true phalloplasty really does require multiple surgeries. And what that staging reference means is it's about the urethra. So you could have a urethra hookup, so it comes out at the tip of the penis in one surgery, or a single stage phalloplasty, or you could build the urethra in multiple phases, which would be called a staged phalloplasty. But in reality, to complete the phalloplasty is multiple surgeries, and that number is generally around 3. Let's start how I do them. And how I do them is really in the following way. So the first surgery, I do the entire urethral hookup. We take out the vagina, we make the scrotum and make the male appearing perineum. That is an inpatient stay, so you're in the hospital about a week. That's where your recovery is really the hardest because the other 2 surgeries are outpatient. So sometime around 3 to 6 months later, surgery number 2 happens. And what that surgery is at the end of surgery 1, what your penis looks like is a tube. And what we have not done in that first surgery is make the shape for the head of the penis, which is what happens in surgery 2. So that is called a glanceplasty. The reason that we don't do it that way is that the shape of the head of the penis doesn't hold as well as if you do it in the first stage. And it also compresses the urethra. And I'm going to come back to that in a little bit later. The urethra is where things can really go wrong after a phalloplasty and where a lot of the common complications are at. So the last surgery is where we put in the implant. So you don't have to have surgery number 3, but if you want to have the ability to have an erection, to have penetrative intercourse, then we have to put in a penile implant, which we would do in surgery 3, along with putting testicular implants in as well. So I mentioned the urethra, and I want to come back to that for a minute. And at the best centers out there, the urethral complication rate is between 25 and 30%. So there's a 1 out of 3 chance that something could go wrong with the urethra, where you would have to have a 4th surgery to land you at your desired functional outcome. And those urethral problems would be either a leak, a narrowing, or a piece of scar tissue called a stricture, or both. So the good news is that if you were in that case, that's also an outpatient surgery that has a pretty good, at least a reasonably reliable success rate. And it takes place after surgery number 1. So for 75 to 67% of guys out there, it's 3 surgeries. For another 25 to 33%, it's a 4th surgery. So phalloplasty is a big commitment. Any more questions, I'm happy to answer them in the office. Thank you.